At Charlotte Skin and Laser, we have started a hair loss clinic where we help patients address the cause and introduce to them treatments for their hair thinning and hair loss. Hair is a very important part of a person's identity and a youthful appearance and a healthy appearance. It frames the face, and thinning hair can identify you as older, and it can be very troubling for individuals. What I have found is many patients have been to other physicians or other dermatologists who have said, oh, your hair loss is normal, your hair thinning is normal, it's related to aging, and it might be, but it is of such cosmetic concern to many patients that we wanted to address it and appropriately identify causes for patients and help them with their issues. So when you come in for a hair loss consultation, we will carefully evaluate the source of your hair thinning, whether it be a medical condition or secondary to a medical treatment or an age-related genetic thinning, and outline a treatment program for you. We focus only on non-surgical hair restoration treatments, and we refer out for hair transplantation if needed. Our treatment plan will include an outline of medical treatments if necessary, home treatments for you, and in-office treatments. The medical treatments might include prescription medicines like finasteride, oh, I know. The medical treatments might include medications like finasteride and oral minoxidil or dutasteride, or maybe even treatments in the office like injections or topical solutions. Home treatments include topical minoxidil and even low-level laser treatments that you can use at home, and maybe oral supplementation. We'll also give you advice on nutritional improvement of hair. In-office treatments that we offer include PRP or platelet-rich plasma treatments, laser treatments called Keralase. Now I'm forgetting. This one I did not prepare for. What do we offer in the clinic?
PRP, Keralase.
And that's it?
Yeah.
Okay.
The Ultra MD. You use that with it?
Nah,
No.
it is Ultra MD.
Okay.
In-office treatments include platelet-rich plasma or PRP injections and Keralase treatments. Let's talk about each one. PRP is platelet-rich plasma, where we draw your blood and spin it to isolate the platelets. And platelets come out on the top are loaded with growth factors that help hair grow. Once we've isolated those, these are injected in the scalp to stimulate hair growth. A series of treatments is needed. Generally, we'll recommend 3, but you'll also need maintenance treatments, either quarterly or a series of treatments every year. Keralase treatments is a laser treatment that's a fractional 1927 and is done in the scalp area with no downtime, and it's paired with a proprietary serum that stimulates hair growth. The laser treatment itself helps stimulate hair growth, but it also increases the permeability of your skin to the serum. So after the laser treatment, your serum penetrates into the skin 5 times greater than just rubbing a serum on your scalp without the laser. So the two work together, the laser and the serum. And a series of treatments is needed, and for all of these a maintenance plan is needed to continue to help stimulate the hair.